sometimes it can feel like Ministry of Health is speaking Russian to Ministry of Finance, and Ministry of Finance is answering in Greek. We have to learn each other's languages. We are so happy to be today launching Cohort 3 of our Health Financing Systems Accelerator Fellowship. It's an equal investment in people and policies, and we feel that it's that dual investment which is really going to unlock impact for Africa and especially address the many health financing issues. Well, right now we're really at a crossroads where we have a perfect storm made up of three different things happening at the same time. We have a huge amount of fiscal pressure on countries where debt servicing tends to be what consumes most of the budgets even before they can think about allocation to health or education or agriculture. We have less supply of external funding given there's been huge cuts since last year. We know Gavi and Global Fund weren't able to meet their targets, so while countries are planning what to do with those budgets right now, it's for lower amounts, and we also know that many bilateral donors have revised their strategies. So that really leads countries to have to think, what can they do to meet the moment? And the third thing is that we have immediate health needs. Ebola is currently on this continent, and whilst governments may have planned to do something already, they're faced with this urgent outbreak, as well as the impact of tax cuts, for instance, on fuel that have happened as a result of the war in Iran, which means that the overall pot of money going to the country is shrinking. So that's why both people and policies need to come together to be able to solve this tough equation, bring health economics, but bring critical thinking in order to still be able to save as many lives as possible. We've brought in fellows from Ministries of Finance. When we think about what needs to improve to unlock health financing outcomes, all of it is a dialogue between Ministry of Health and Ministry of Finance. From mobilizing more money for health to ensuring that that's allocated to the highest return on investment areas, to then solving issues with budget execution and ensuring that the funding can really flow to the front line, the dispensary, the community health worker. All of those issues cannot be solved by health alone. Sometimes it can feel like Ministry of Health is speaking Russian to Ministry of Finance, and Ministry of Finance is answering in Greek. Because the acronyms are different, the concerns are different. For health, we care about patient impact, we care about outbreaks, we care about DALYs, the disease adjusted life years. The Ministry of Finance cares about budget credibility, cares about execution, cares about fiscal sovereignty. We have an expanded geographical footprint with, for instance, Tanzania joining the cohort. So ministers of health themselves and Ministries of Finance have handpicked critical people who can really lead the design and the operationalization of these reforms. And we have more and more reforms looking at public financial management, direct facility financing, efficiency, just because of the context. We don't think about it as a financing alliance for health program. We think about it as the accelerator for health financing on this African continent, and we want to bring the best of the technical expertise of many collaborators who are really experts in specific domains. So that's why we've had, for instance, McKinsey come in on problem solving, why we have in the next few days a range of organizations, IPHCE on primary health care, we have CHAI on public financial management and digital, SEED will come in on human resource for health, we'll have PATH come in on certain aspects of domestic resource mobilization. We'll have AMP Health come in on some of the essential soft skills to make reforms stick, and many others, for instance, on debt swaps, who will really be providing the essential toolkit to understand where we are right now in terms of health financing and health economics, and help ensure that these reforms that are being designed are done so with the best of the technical expertise of